Hello, I am Urologist Ömür Erdem Akkaya. Today I will have a short video presentation on how prostate biopsy is applied. Prostate biopsy is applied if prostate cancer is suspected in patients. Let me briefly explain how the most used prostate biopsy in our country is done. In prostate biopsy, in urology, we do it by entering from the anus with an ultrasound probe, observing the prostate, and taking samples from certain quadrants of the prostate. To briefly describe the prostate position, the prostate biopsy is done as you can see on the screen in the side position or in the woman's birth position, which we call the lithotomy position. During or before the procedure, the comfort of the procedure can be increased by giving general anesthesia or local anesthesia to the patient. Then, the prostate is evaluated after entering through the anus with an ultrasound probe. Then, as you can see here, a sample is taken with a needle, and these are needles around 25 centimeters in length. 1 mm samples are taken. In prostate biopsy, sampling can be applied in 6, 12, 18 or 24 quadrants. As you can see here, for example, a sample is taken from non-cancerous tissue. Here, for example, there is prostate cancer in the left lobe of the prostate, and a sample is taken from that area as it shows. There is prostate cancer here, but samples are taken from areas without prostate cancer and the result of the patient is clean. The patient's prostate cancer cannot be detected. Here again, there is a small prostate cancer tissue in the patient. We cannot see the prostate cancer tissue on ultrasound here. And the ultrasound we do consists of dividing the prostate into imaginary certain areas and taking equal parts from those areas. What can happen to a patient after prostate biopsy? There may be bleeding in the urine, and blood may come from the stool and semen. There is nothing to panic, it will fix on its own. If the patient is using blood thinners, it is recommended not to use them immediately. In addition, after the procedure, acute prostatitis may occur, which is prostate inflammation and high fever, which are very rare but important. Then we may need to give the patient antibiotics or hospitalization. In that case, the patient should inform the doctor. But apart from that, prostate biopsy is an easy, short procedure that takes about 15 minutes. Patients sometimes confuse this with surgery, but there is nothing to fear. Prostate biopsy enables the patient to be diagnosed early, to receive early treatment, and perhaps to get rid of the disease. Maybe it will save the life of the patient and ensure a better quality of life. That's why we definitely recommend it when necessary. If you have other questions, I can answer them in the comments section. You can find more detailed information about prostate biopsy on my website. Thank you for listening. Best regards.